Hi, my name is Rob Cantrell. I am a licensed advanced drug and alcohol counselor here in Los Angeles. I have a master's degree in addiction counseling, and currently I'm a doctoral learner at California Southern University with a hopeful degree in psychology. Today we're going to talk about substance use disorders. How do you fix it? Based on information we've received, 22 million Americans have used illegal substances within the last month. 24% of all high school seniors have used drugs, illegal drugs, in the past month as well. So what exactly is this? The DSM-5 has broken down the definition as substance use disorders occur when the recurrent use of alcohol and/or drugs causes clinically or functionally significant impairment, such as health problems, disability, failure to meet major responsibilities at work, school, or home. And to get a diagnosis, it's based on evidence of an impaired control, social impairment, risky use, or pharmacological criteria. Now, the DSM-5 has broken this down from previous DSMs. It's broken it down into a more simplified form of understanding the sciences of addiction. DSM-5 now put drugs into 10 separate classes, and there's 11 criteria that need to be met to find out if an individual actually is dealing with a substance use disorder. In addition to that, it's now dubbed into the severity and specifiers. How severe a drug issue a person has, if the person is currently using, if the person is in remission. So what causes substance abuse disorders? I think this probably is based on whoever it is that you speak with. Cognitive behavioral views believe that operant conditioning plays a role in substance abuse, and that's the temporary reduction of tension produced by the drug has a rewarding effect in the brain. The user will seek this reaction again. The person felt calm and relaxed when he had the glass of wine, so he comes home tomorrow night and he has another glass. The rewarding effects lead to higher doses and more powerful methods of ingestion. You know, once a person may snort cocaine, the next time the person may inject it, IV. Cognitive behavioral views, again, studies show that users drink more alcohol and heroin users use more heroin under tense situations. This leads to a model known as self-medication. Biological views believe that genetic predisposition plays a role. Research shows that alcohol-preferring animals have offsprings with similar characteristics. They also are alcohol-preferring. Works basically the same with human twins. Twins inherit the same type of predisposition. Identical twins have been shown to have a 54% predisposition. As fraternal twins, it's lesser, but it's still there at 28%. If you look now at biochemical factors, these theorists believe that when substances repeatedly stimulate the brain's reward center, the center develops a hypersensitivity to the substances. And this theory is actually known as incentive sensitization theory. So, how are these substance use disorders treated? How do we treat these things? We're kind of figuring out what caused them. How do we take care of the problem? If you look at the approaches that have been used, there have been psychodynamic, behavioral programs, cognitive behavioral, biological, sociocultural, therapies. They've all been tried. None have been overly effective independently. They work very, very well together, and we'll see how they're mixed and matched. The psychodynamic theorists guide clients to the underlying conflicts that they believe led them to the disorder of substance use. Then they help them change their styles of living. This has not been an effective means of treatment. Behavioral therapies, this widely used behavioral treatment is aversion therapy. And the approach is based on classical conditioning principles. Individuals are repeatedly presented with an unpleasant stimulus at the very moment they're taking a drug. There's a drug anabuse that's been used effectively, which brings this to light. A person drinks alcohol, they ingest this medication, the person instantly gets sick, plants the seed that drinking causes negative reactions in the body. Again, behavioral approach that has been successful is contingency management. And this procedure makes incentives contingent on the submission, let's say, of a drug-free urine test. You come in clean with your drug test, you'll stay out of jail for another 30 days. Cognitive behavioral treatments have helped identify and change the patterns and cognitions contributing to substance misuse. This has been very effective. Then the most prominent of these approaches is relapse prevention training. The overall goal is for clients to gain control over their substance-related behaviors. The client knows going to a bar on Friday night is going to cause him to relapse. He'll probably need to stay away from the bar. Clients are taught to identify and plan ahead for high-risk situations and to learn from mistakes and relapses. This approach is used particularly to treat alcohol, cocaine, marijuana, and crystal meth. Biological approaches may be used to help people withdraw from drugs, abstain from drug use, and level off use of any substances. Now, with biological treatments, detoxification is used under these treatments. Detoxification has two stages. It's a way to safely bring someone down off the medications or the drugs that they're addicted to. Gradual is a tapering method. Induced is a very rapid method where they're also given other medications to keep them from going into seizures or having further problems. Another scenario is drug maintenance therapy, and this was well known with people getting off of heroin. They used methadone maintenance programs, and it's a safe alternative to heroin, but the argument had always been that you're just substituting one drug for another. In the era of HIV and AIDS, it's gained popularity once again for keeping people from using dirty needles. The three sociocultural approaches have been applied to substance use disorders and have been very effective. Self-help programs, which handle cultural and gender-sensitive programs. There's community preventative programs. And we're finding that self-help residential programs are hugely effective. The most common being Alcoholics Anonymous. It's a peer support group that handles both moral and spiritual guidelines, where people come together and find strength through the unity of others that have issues. Another important factor is culture and gender sensitive group, and this is something that's come to light recently. These therapies are sensitive to the typical sociocultural pressures and problems that face drug abusers who are poor, LGBT, homeless, members of ethnic minority groups. Therapists have become more aware of women, and the interesting part is that women approach treatment much differently than men in the process of recovery. Community prevention groups are the most effective, and that's done through education. Prevention groups can focus on an individual, on a family, on a peer group, the community as a whole, and the most effective of these prevention methods, of course, is education. Educate that individual, you can educate a peer group, which will then spread into the community itself. What's important is that the individual find a method that works best for them and lives a life free of substance use disorder. I'm Rob Cantrell. Thank you for watching this video.